The state of Georgia had a very serious problem to resolve. We were operating a behavioral health system that had 25 different points of entry. We needed a place that our citizens could go and receive services by calling just one number. At the same time Katrina hit, bringing into Georgia tens of thousands of evacuees that were in need of trauma services. DHR was totally unprepared to deal with this and had to respond quickly to meet their needs as well as meet the needs of Georgia's citizens.
And so the DHR chose to purchase a statewide toll-free crisis line. We wanted telephonic crisis intervention. We wanted the individual to receive choice of providers on the phone, and we wanted reporting and data for the future for strategic planning, and we got that through BHL.
The Georgia Crisis and Access Line was started in 2006 as a free and confidential hotline for individuals in psychiatric crisis or needing any level of mental health or addiction services. It's the fast, friendly and easy way to gain access to services, and in that time we've received calls from all 159 counties.
300,000. That's how many calls the BHL did last year. And those weren't just calls from individuals in crisis. Those were calls from their friends, their families, and professionals who support them. We have a system that can be high-tech, and one of the good things about that is the state is constantly interested in data so they can fill gaps, improve the system, so we can give better service to these individuals.
Asking for help can feel like picking up a 400-pound phone. Around the country, the mental health process is complicated, it's confusing, complex.
But the Georgia Department of Human Resources is working to change all that. DHR is funding an innovative new service that is being managed by Behavioral Health Link. The Georgia Crisis and Access Line is revolutionizing the expectations of people seeking mental health and substance abuse services by providing a single point of contact experience. Our clinicians engage and collaborate with callers, perform a clinical triage to determine what services best match their needs, and discuss options. We offer prioritized choices based on the fastest, highest quality provider. We even schedule the appointment at one of hundreds of sites across the state of Georgia.
And the Georgia Crisis and Access Line has received much national recognition. We were cited by CARF as a promising practice, the first one in behavioral health. We were also given a Crisis Center Award by SAMHSA, which oversees a national crisis call center network in the United States. And I think the secret to this success is what we refer to as the H3 model: high touch, high tech, and high volume.
Our team receives more than 1,000 calls on most days. But when an individual calls, we want them to feel their individual call is the most important call we've had that day, because for them it's the only call that is important.
It's important to us that the technology not become a barrier, and rather that it supports and empowers the crisis worker with a wealth of rich information, the ability to communicate, and prompts that coach them, all at their fingertips.
And this year we received our 1 millionth call. Our goal is to provide services for even more Georgians in the future and to do that more effectively.
The Georgia Crisis and Access Line is there 24 hours a day, 7 days a week, so that when someone does pick up the 400-pound telephone, they can be connected and feel linked. Ours really is the first step to personal wellness.